So Claudia, my question, again, having the background in nursing that you have, what is defined as a medical error? I mean, people I think probably think it's just some simple thing, but you actually said that there's actually a number of specific breakdowns of what medical errors are.
There are 5 different categories of medical errors that include medication errors, which is one of the things that the public often thinks about when they think about an error being made, that it's a medication error, or the physician made an error. Well, it's not always physicians. Anyone in a hospital can make an error, from nurses, physicians, lab technicians. The unit secretary on a patient care unit can put lab data on the wrong chart, and all of a sudden a patient's being treated for something that had nothing to do with his illness. So all of these are different types of errors. You can get infections. They didn't used to count infections as an error, but now they do. And there is an error that is called a delay in treatment, and that can happen when, for whatever reason, someone doesn't get to you in time to prevent you from getting worse. So there is a multitude, and within that there's even smaller breakdowns. There's about 1,000 ways you can make an error in a hospital.
Right, and that was actually my question I'm going to throw to you, Bill. Just by what Claudia said, how significant is this problem?
Well, it's serious. The public is unaware that preventable medical errors cause between 500 and 900,000 patients' deaths every year. It's the nation's leading cause of death.
I'm sorry, Bill. I have to stop you. Please say that number again.
Between 500,000 and 950,000 patient deaths a year as a result of medical errors. Now that number seems huge, and with huge numbers being tossed around on the media all the time, it's kind of hard to really focus in on it. And I think the primary focus should be, if you can imagine 10 jumbo jets daily crashing in Sarasota with the loss of all lives.
Daily?
That's what goes on in America. Not only America, but it's a global pandemic. All industrialized countries basically share in the same incident rates of medical errors.
Okay, so what you're saying, of course, we've established that America certainly has as high a level of care as anywhere in the world, maybe the highest. And so we are no higher or no less high as far as the incidence of medical errors from any other country, developed country or otherwise, correct?
America's secret pandemic emphasizes the fact that people travel from all over the world to get the best medical care the globe offers, and that's the United States. There's no doubt about that.
Yes.
But medical errors still continue to affect the quality of patient safety during treatment, diagnosis and treatment. So you're right, we still have that pandemic.
Well,
share it with the rest of the world.
Sure. Now